This morning on today's checklist, we are talking about checkups. The new year is a good time to start to plan health screenings and doctor's visits, and there are some things you need to know before you go. So here to help us prepare is NBC News medical contributor Dr. John Torres. Happy New Year, Dr. Torres.
Happy New Year.
How are
Great
you?
time for resolutions.
Great
so
time
it's a great time to start these things.
We're all into health right now. So what are some things that you need to keep in mind and have in place before you go to the doctor?
And the biggest thing to keep in mind is you're going to have a limited amount of time, and everybody knows that. 15 minutes, maybe 20 minutes if you're lucky. So you want to make sure that you get things ready before you go there. And that means if you have questions and concerns, a lot of people worry about bird flu, talk to them about bird flu. Great person to talk to. Bring a list of your medications with you, a list of those questions as well so you don't forget any of them. But also know your family history, both medical history, recent procedures you might have had, mental health history, those kinds of things. So when you sit there with a doctor, number one, you make sure you don't miss anything. You're your own advocate. And number two, you do a very efficient going through the process there. It helps us out as doctors, helps you out as patients.
Okay, perfect.
Right, so, Doc, what about screenings? What are the screenings we should be scheduling?
So that's one important thing. And as we age, there are lots of screenings, even from birth until the time where, where life ends, basically. A lot of screenings. You want to make sure you get an annual physical. Right. And there's a couple of things. One, when you turn 65 and you get into Medicare, you can get an annual wellness physical or annual wellness checkup. It's not a physical, but they're going to talk to you about your health, your assessments, things you want to do later in life, your mental health, those kinds of things. But as you age, here's the big ones. These cancer screenings are extremely important. Breast cancer, when you're 40 to 45, depending on your risk, you want to get a mammogram to make sure that you don't have breast cancer. Screen for that. Cervical cancer, age 21 to start cervical cancer. Colorectal cancer, that has dropped down to 45 now, unless you have higher risk factors, and it might be even earlier. Lung cancer, what they're saying is if you're 50 and above and you have a history of smoking, think about getting that lung cancer screening. Extremely important. Skin cancer, there's no specific age for it, but if you notice something, talk to your doctor, and your doctor might say, let's go ahead and do that. And again, 65 and above, that wellness screening that you get for Medicare is extremely important because it talks about what you want to do as you go forward.
What about for men, prostate cancer?
Men, prostate cancer, same thing. Right now, prostate cancer is one of those ones you definitely want to talk to your doctor about to get. Basically, it's personal, so it depends on what you want, what your risks are, and where you want to go from there.
All right, thanks.
Dr. John, let's talk about the kiddos, because as they're growing, they need to get those checkups as well. What are some things that parents need to keep in mind with regard to that?
So even starting from birth, you have to start looking at the kids and what they need for certain screenings. That means bringing in their immunization records and other health records, any procedures they might have had, any urgent care visits they might have gone to because the doctor might not know about those, might not be in their computerized system. Immunizations, extremely important. As you guys know, I'm a huge advocate of getting vaccinated, and so make sure they get them appropriately throughout the years because these are diseases that are very, very preventable. Physical exams, there's going to be yearly physical exams, and there's going to be sports physical exams as well. If they're participating in sports later on in school, that's an important time to get that. And then, again, update those needed vaccines.
And Dr. John, when kids get to be a certain age, the parents are actually asked to leave the room at the doctor's office. Why is that?
And, for the most part, as a parent, as a patient, as a doctor, I ask the parents to leave the room, and sometimes I get that hesitancy, that look, and I'll talk to the parents. I'll say, here's the deal. There are questions that I'm not even going to ask your son or daughter if you're in the room because they're not going to answer it freely, and I need to make sure they can answer it freely. If you look at it by state, there are state laws as to what minors can do on their own and what parents don't necessarily need to know or legally aren't obligated to know, and it starts at age 12. And so I might ask you to leave the room because I'm going to ask them about mental health. I'm going to ask them about sexual health. I'm going to ask them about drugs and alcohol, those types of things. And some of those, even the 12 or 14-year-old, you as a parent might not be legally able to know. I might not be able to tell you.
Makes sense.
Unless they're going to do something to themselves, unless they're going to be a harm to themselves, then I can tell you as a parent. Couple things. It helps them be free and talk to us about what we need to talk to us about, but it also builds that independence and builds that confidence
Doc,
to be able to
quick,
talk to somebody.
Where do you make that transition from your kid being at a pediatrician to a regular adult doctor?
It's good. Pediatricians can take them all the way up to age 21, but at the same time, you talk to your child and say, do you feel like you still need to go to this doctor? Is this somebody you're comfortable with? Do you want to advance and go up to more an adult doctor? And so it's going to be a conversation you have with them, much like these conversations you have. And certainly, I encourage the child when I talk to them alone and talk to them with other parents, I say, some of this information, let's talk to your parents about it, and we can either talk together or you can talk to them. And there are some times where they'll say, I don't want my parents to know this. And as a doctor, I'm obligated to not tell the parents.
Wow, interesting.
Okay. Dr. John just learned a lot.
Thank you.
Thank you, sir.
Hey, thanks for watching. Don't miss the Today Show every weekday at 11 a.m. Eastern, 8 Pacific on our streaming channel, Today All Day. To watch, head to today.com/allday or click the link right here.